Preparing for the worst, but hoping for the best. That's the message the state is sending with the opening of a 500-bed treatment center at McCormick Place for COVID-19 patients. CBS 2's Dana Kozlov, our political investigator, got a look inside and joins us live. Dana, it's important to note you can't just show up there, right?
No, Brad, people won't be able to just show up here at the new alternate care facility now inside McCormick Place. There will be a process for admittance. And if a patient is admitted here, that patient would be cared for by a staff working 12-hour shifts, in part to conserve the use of personal protective equipment, which is still in short supply.
There's an enemy out there, and that enemy is the virus.
Army talk from the Army Corps of Engineers about the urgency to convert this massive McCormick Place space into a 500-bed alternate care facility for COVID-19 patients if needed.
This will never be a place that has an emergency room. It will never be a place that people come to the front door and admit themselves. This is a place that will relieve some of the strain from our hospital partners.
The facility's executive director says patients with less serious COVID-19 cases would be referred here by other hospitals or their doctors. Governor J.B. Pritzker says staff for the first 500 beds has already been hired. They're medical professionals from around the state and could eventually even come from out of state, with the goal of not taking resources away from other Illinois hospitals. This conversion took place, done, in about 4 days. Mayor Lori Lightfoot says by the end of April, these 500 beds will go to 3,000.
All of which will provide wraparound services for these patients, of course, medical care, but also all the other amenities that are necessary for a care facility of this type.
If no patient ends up at McCormick Place, then we will have done our job.
Both the governor and the mayor say this massive transformation was also a massive collaboration with the help of the Illinois National Guard, the Army Corps of Engineers, dozens, if not hundreds, of union laborers, medical personnel, and the like. If it goes into effect, if it is used too, medical staff will be pulled from other states if needed, but I don't think we're there yet. Brad?
Yeah, Dana, how much will those health care workers make? Who will pay them? And then, considering what type of environment they'll be in, will they be able to go home at night, or where will they stay? What about those logistics?
Well, you know, Brad, there were reports that they might be paid $125 an hour, but Dr. Turkle, the executive director of the facility, did not want to talk about pay today. So it's still unclear exactly how much these workers here at McCormick Place would be paid. And you know what? It is a good question exactly who will be paying them. That's something I'll definitely have to look into. But regarding healthcare workers who might need somewhere to go, whether they work here at McCormick Place and can't go home, or they work at other facilities. This afternoon, Mayor Lori Lightfoot announced that 2 downtown hotels are going to be having beds for those healthcare workers who need to go there and use them instead of going home. 425 beds in all, she says, at these 2 hotels, London House and the Godfrey Hotel, beginning next Wednesday.
$125 an hour, that may sound like a lot, but you're being asked to risk your life and then not go back and stay with your family. So let's put that in perspective too. Another question, a lot of self-congratulations today, and rightfully so at McCormick Place. A lot of back patting. Hey, we did a great job. How wonderful. Everything's great. But right now, 0 overflow beds are needed. 0 statewide. And when it comes to the governor, who did a lot of that self-congratulatory stuff today. We've got people desperate, and Dana, you've been covering this story. People cannot get their unemployment, and we've got tens of thousands of those. Did he talk about that at all today, that juxtaposition? Granted, those beds are going to be needed, but people need unemployment right now, and the state system isn't working. Did he say anything about that?
No, you know, honestly, that didn't come up this afternoon, and I should mention it was a pool feed, so I wasn't able to directly get in there and ask questions, too. It was brought up yesterday. He says there's a lot they're working on in regards to helping those people still trying to get unemployment. That's something I'd like to continue looking into. But going back to this facility here, he did say he hopes these beds will never be needed, but now they're here if they are.